Hello, I am Dr. Irgau. I'm a surgeon at the Christiana Institute of Advanced Surgery, CHRIAS. Today, I will be talking about gallbladder surgery. Before I talk about gallbladder surgery, I need to tell you what the gallbladder is, what it does in our body, what conditions may lead to the need for gallbladder surgery. So let's get started. What is the gallbladder? Well, the gallbladder is a little organ that is part of our digestive system. In fact, if I can show you on this diagram of the digestive system, you will see that the gallbladder is a little organ, a small sac that sits right underneath the right side of the liver. It is attached to the liver as well as to bile ducts. The function of the gallbladder is to store bile until bile is needed by our digestive system. Now, gallbladder disease occurs because of the presence of what we call gallstones inside the gallbladder. Gallstones are small stones that can occur inside the gallbladder, and they are often associated with gallbladder disease. The symptoms of gallbladder disease are variable. The more common ones include discomfort or pain, typically on the right side of the abdomen. They can also include nausea, sickness, or even fever. If those symptoms are occurring, your physician may decide to do further testing. Those tests may include an ultrasound, which is an imaging study, or even blood tests. And if gallbladder disease is suspected, one of the treatments that may be recommended is gallbladder surgery. Gallbladder surgery is perhaps the more common form of treatment for different types of gallbladder disease. Now, gallbladder surgery essentially means removal of the gallbladder. Now, if we go historically, we will see that surgeons have been performing gallbladder surgery with what is known as open surgery. And that essentially meant the surgeon making a big enough incision on the abdomen to be able to insert their hands inside and physically remove the gallbladder with their hands. In the last 15 to 20 years, surgeons have been performing what's known as laparoscopic surgery. That is surgery which is undertaken through small incisions, slender instruments, typically 4 or 5 incisions. More recently, we have been doing what is known as single-site gallbladder surgery. Single-site gallbladder surgery is different because it's undertaken through a single but small incision. And that incision is made really at the level of the belly button, the umbilicus, which is a natural scar. So an incision made on the belly button, once it heals, it is completely hidden by the natural scar of the belly button. So a person who's had surgery with a single-site approach may not notice any remaining signs of their scar afterwards. So from an aesthetic point of view, there is a great advantage when single-site gallbladder surgery is undertaken. Another advantage of single-site gallbladder surgery is the fact that it is undertaken with the latest robotic technology, with the Da Vinci system, which gives surgeons great visualization. The high-definition picture that is afforded with the Da Vinci system helps surgeons minimize the risk of complications of this surgery. In addition, surgeons can use something called firefly technology, which allows them to identify the bile tracts very clearly at the time of the surgery. Not everybody is a candidate for single-site robotic surgery. Laparoscopic surgery or even open surgery may still be indicated in some situations. And before undertaking gallbladder surgery, it's important to review with your physician the risks and benefits of all options, including risks and benefits of the surgery versus not doing surgery. Gallbladder surgery, like any surgery, has a potential for complications. Fortunately, the very serious complications are rare. Bleeding infection, or even damage to some structures related to the gallbladder can occur. But as I said, these are not very common. One of the common questions that patients ask me about gallbladder surgery is how their digestive system functions in the absence of the gallbladder. Some people occasionally can experience diarrhea as a result of the absence of the gallbladder, but that settles by itself within a few weeks at the most. So the vast majority of people who have gallbladder surgery actually don't even notice its absence. Well, thank you again for tuning in. If you need further information, you can go to our website at CHRIAS.com.